Hello, how are you guys doing? My name is Chris A. Matthews, and you are tuned into the Marriage Underdogs Radio Show podcast. And we have a phenomenal guest. And yes, they are a licensed marriage and family therapist. I want to introduce you guys to Alan Simberg. How you doing, Dr. Simberg?
Oh, hi, Chris. Thanks for asking. I'm doing well, and I really appreciate the opportunity to be of service to your listening audience.
Hey, we appreciate you being here. And as we were speaking before the show, you've been in this line of work for over 50 years. And I get excited about that because the wealth of knowledge, the experiences, all the things you've seen, it's just a joy, a blessing, a gift to have you here. And as we were talking, you became a licensed marriage and family therapist in 1982. You entered the counseling field in 1972, and you've practiced across 3 states in your career: New Jersey, Arizona, and Texas. And you're currently in Houston, right?
Yes.
Awesome, awesome. So what we're going to really focus on in this episode, based on your expertise, you also have a book out. And
Yes.
your book focuses on getting back to living for those who are in recovery of addiction, recovering from addiction. Is that accurate?
Yes, that is.
Oh man. And those that have followed me or my career, they know that I started in the field of addiction almost 2 decades ago. So I love the field of addiction treatment, the clientele, the population, because I'm all about second chances, third chance, fourth chance, as many chances as you need to get it right. And I wanted to start by asking you what led you into the field of addiction treatment.
Well, I consider it to be an interesting story, as most of life is. I was working in the court system at that time in New Jersey, doing psychological evaluations of adolescents. When I went downstairs one day in that building, I saw on the bulletin board there was an opening in an inpatient drug and alcohol treatment program for an outpatient family therapist. And I thought to myself, some of my friends, that's their specialty. I don't know that much about addiction. I'm going to apply for the job, see what happens. I got the job. And within meeting with the families, maybe 1 or 2 times, I had to get licensed as an addiction specialist. I just felt like I felt it as a calling. Now, what a lot of people will ask me is, oh, so, I don't mean to get personal or anything, but like, are you in recovery?
That's
And
a
they'll
common
ask like
question,
in
right? I
different
get
ways,
that. Yeah.
And the thing which really bothered me for a long time is that I'm not in recovery. I have no reason to be in recovery. And the reason it bothered me is I used to think to myself, what right do I have to help people that have addiction challenges when I've never gone through that? And what I was able to come to in my own mind was that just because I've never had that challenge doesn't mean I can't be helpful.
Right.
And what I found was I've been blessed enough that I have been able to be helpful to a lot of people. And then that guilt went away.
Absolutely. And, I've gotten that question as well. I haven't formally been diagnosed with any substance use disorders. I've never gone through a treatment program myself, experimental in college. But when I was in the field or coming up initially in my career, that was the question. People would ask, so do you use drugs, or have you ever used drugs or alcohol, or are you in treatment? And I would share with clients that I've never been diagnosed. I haven't had any treatment, which makes me a really good candidate to help you with your addiction, because I know what it's like to live an addiction-free life. So you don't learn how to be a millionaire from someone who's broke.
That's right. That's right. That's right.
So,
And it's 100% true.
so you actually were the right person. Now I want to dive deeper in that, because you mentioned the job entailed working with families, and our show we focus on couples, relationship partners. Talk about what you've seen along your career when it comes to the enabler, the family member who unintentionally may be supporting or adding fire to the fuel of a spouse's addiction.
Well, basically, the way I work with people that, let's say, for example, are enabling a certain behavior, or actually almost anybody, is I focus on what the person needs that can be the most helpful in the quickest way possible. So
Hmm.
let's say, for example, I'm working with a family or a couple, even just a couple, and let's say the person who's not drinking or using drugs or engaged in any kind of behavioral addiction, rather than labeling, I describe. So I would never say to somebody, do you realize you're an enabler? What I would say to somebody, which I have said, is that, do you realize that some of what you're doing with the most caring, loving intention could be contributing, not causing, but contributing to the person's ongoing drinking or using drugs or whatever? And usually, whenever I've said it in that way, it sparks the person's curiosity, and they want to know what I mean by that. And I also acknowledge right up front how difficult it is not to be as involved as possible because you want to be helpful, but there has to be a balance because the person's recovery is up to them. And
Right.
that's where, when the line gets crossed, where someone is taking responsibility for someone's recovery, in a sense, that's what enabling is all about.
Hmm. And I like the reframe you provided because you're sharing with the spouse that you understand their intentions are to be loving and caring. And that's important because if someone is enabling or contributing to their spouse's addiction, they're not doing it usually with malice intent. They're actually doing it out of love and care. I want to ask you this question. I had a couple I treated several years ago, and the male partner was in recovery for substances, and the wife shared with us in counseling that she felt guilty because when he stopped using drugs, he wasn't as sexual, and she was less pleased intimately in the bedroom when he was sober. So she grieved the sexual experiences when her husband were using when he was using drugs and compared to how now when he's sober. What would you share or what would you say to a couple like that if they came to your office and they mentioned how there were perceived benefits of their spouse's addiction, but they don't want them to go back to using drugs, but they also are inciting that the sexual experiences were better when they were using drugs?
Well, the first thing I would do is I would talk to the person who's feeling guilty, because in the situation that you just described, what I would think, which I would check out, I always do my best never to assume, is the person feeling guilty because they're feeling responsible for the absence of enjoyment with the physical intimacy.
Hmm.
Because I would think that that would be one of the most important initial things to clear up and help the person to realize that they're not responsible. I would also acknowledge the disappointment, and then I would focus on identifying what's contributing to the difference now that the spouse is sober or abstinent or however you want to say it, and then come up with solutions for how the situation could become better, but possibly not be the same that it was when the person was drinking, but could still be highly satisfying.
Got you. No, I like that you mentioned the solution piece, because several critics of counseling will say that counseling doesn't work because you just go and you talk and you leave, and the therapist doesn't give you any practical solutions, skills, or tools. And as you know, I'm LMFT as you are as well. Um, our training is a little different. We are intervention based therapists, so we do give tools and interventions and skills, and most therapists potentially, for that matter, do. But what would you say to the couples who are battling with any particular issue they're bringing into counseling, and they are calling you, requesting an appointment, and they have a concern about if therapy is going to be a deliverable solution with tools? Like, what do you say to that person to encourage them to do therapy and it go beyond just being listened to?
Well, ironically, recently, very recently, I've had several potential clients say that exactly to me. And what I explained, and they became clients, and what I explained is that different therapists have different ways of talking with people. There are some therapists that believe that a person can come up with their own solutions. And for the person who can come up with their own solutions, that's a great approach. It may take longer than it needs to. And then I say, so I'm guessing part of what you're asking me is, what is my approach? And I
Mm-hmm.
basically explain that my approach is to have them tell me what their challenge is, for us to identify solutions that they would be willing to try, for them to use the solutions. If they work, great, let's keep going. If there's a problem, they're not satisfied with the outcome, we figure out what's contributing to their dissatisfaction and come up with another solution.
Nice. I like that, because what you're saying is you're allowing the client to acknowledge that every therapist is different. And for that client asking that question, they may seek a therapist that's more proactive in terms of providing solution, being more of the expert in the room. And if the solution does not work, then we'll just try something different. So giving them that opening to understand that it is trial and error. And a lot of medicine in general is trial and error. Talk therapy, mental health, it's all trial and error. No matter what, it's all trial and error, because everybody's body's different, everybody's mind's different. People respond different to things, right? Talk about how leading with the solution has been successful for you and your clients when working with couples that come into your office with addiction issues.
Well, one of the contributing factors to the solution focus being successful is I tailor it to the client. I may have the same solutions that I suggest to different people, but I always pick the solutions that I think fits that person and fits that situation. Also, the fact that I communicate with clients in a non-judgmental way contributes to them being willing to try. Even sometimes the client will say, I don't know what this has to do with anything, but I'll give it a try. And then when they see that it makes a difference, it encourages them to continue to trust me, knowing that I'm not going to be judgmental, and I'm always going to be focusing on taking their input into account and being the most helpful I can be as consistently as possible.
Mm. You're making it about them.
Yes.
You're making it about them. And we know that the alliance is the major agent of change when doing counseling. And it sounds like your clients can feel that from you. And give us some examples of what a spouse can do to support their partner who may be reluctant to seek help for addiction issues.
Well, in a certain sense, there are two things that come to my mind immediately. One is for the partner to talk to their spouse about what's the reason or reasons they don't want to get the help based on what their partner tells them, to communicate, if there's anything I can ever do to be of help to you, if you want to talk about this more. But the one thing that I always would suggest to the person to tell their partner is, one of the things that might be helpful for you to think about, this is what they would say to their partner, is what do you actually have to lose if you go into treatment? The worst that will happen is it won't do any good, which really my belief is getting treatment and having the outcome that you want depends on what you put into it.
Mm.
But if you find a treatment center or treatment person, whatever, that you feel can understand, does understand, not can, but does understand you, the best that can happen is things can change for you. So you have nothing to lose because your situation can stay the same the way it is now, and you're not losing anything. It's just the same. But if you give it a chance, it could get better. And of course, one of the things that I don't know whether a partner saying this could say something to their partner, but one of the things that very often, sometimes it's conscious and sometimes it's unconscious, that prevents people from going for treatment is the guilt and shame they feel about what they've been through, and they don't want to tell anybody.
Gotcha. Yeah. I coined the phrase, you have to open up to heal up.
Mm-hmm.
And what you're describing is that. I'm also echoing the sentiment of what you described to earlier around what do you have to lose? And those words are powerful because anybody who's listening now, if you're debating going to couples counseling, individual counseling, or recovery or treatment for addiction, what do you have to lose? And that statement just hits because couples, based on Gottman's research, are in distress for up to 6 or 7 years before they even seek help for their relationship or marriage. So what they had to lose was 6 years of being in a bad relationship. So I love when you said, what do you have to lose? I want to go back to something you mentioned earlier about the solutions that you provide. And you also have resources, your book, and you also have an online program as well. Talk about why it's important for therapists and clients to be open to receiving resources outside of just the talk therapy itself, such as books, courses, and online products. Why are those things valuable or needed in the treatment process?
Well, what I have found is having outside resources contributes to a client doing everything he or she actually can do consistently because they have something concrete to relate to. One of the things that some clients have said to me in the past is they don't understand what the suggestion or the solution, how it can help them. And they're so caught up in the distress that they're experiencing. But when clients have something concrete that they can relate to, it also serves as a guidance for them. So let's say, for example, someone gets frustrated and they don't have that outside resource. Well, the frustration can take over. But if they have that outside resource to refer to, that resource can help them to manage the frustration they're feeling and stay on track with their recovery.
Gotcha. So what I'm hearing you say, the resources, whether it be a book, an online product, a course, those resources are present when the counselor is not present. Those resources are there ongoing because the client's heightened level of distress can hit at any moment or time, and they'll have that online course, they'll have that book, they'll have that resource to lean on, and that'll not only hold them accountable for their own recovery or their own treatment or their own healing, it will be a co-pilot or a partner along the way of their healing. And once the therapeutic process is formally concluded, they'll begin to still have something to lean on afterwards as well.
Yes.
Gotcha. So that's really important, because I've spoken to several counselors, and I was trained that you recommend between session tasks every session. You don't let a client leave without recommending something for them to do, whether it be tangible or experiential. It needs to be something they do and they leave with to highlight or practice the skills they learned in the session with you. Talk about your belief on that in regards of prescribing between session tasks for clients to do.
Well, I think a client having something to do for when they leave the session provides hope of positive change for the client. So I'm going to give a real silly example.
Okay.
If somebody is hungry and they want to get a certain kind of food, but they don't know where the food is, or they don't know maybe where they can get food that they would like, if they get directions on how to go to a place that's known for their good food, then they have hope that they can get the food. So
Yeah.
let's say, I'll give you an example. Let's say a person is drinking, and as you know, it's not always a good idea to just stop drinking immediately.
Right. You can have withdrawal, lethal withdrawal, especially
Yes.
alcohol and benzodiazepines.
Yes.
Yeah.
So rather than talking to a client about, you really got to stop drinking,
Mhm.
I do my best to determine if there could be a seizure if the person stops drinking immediately.
Mhm.
And regardless, let's say there's no reason to believe that, based on history,
Definitely.
there's no reason to believe the person will have a seizure. But whenever we're talking about quitting a habit, regardless of what it is, smoking, drinking, drugs, there's a certain percentage of people, and I don't know what the percentage is. You can read 5 books and get different percentages.
Right.
But there's a certain percentage of people that need to taper. So let's say, of course, if there is danger,
taper down, like
taper down.
yeah, they transition.
Yeah.
Yeah.
So, of course, if there's a potential for seizure, I would either recommend inpatient for detox if the
Mhm.
person wants to stop immediately,
Mhm.
or to taper very slowly. And we talk about how that can be.
Yeah.
And if a person is not so sure they really want to quit, I have found the percentage of people that I talk to are willing to start by cutting back. Because one of the things that I always do my best to help clients recognize is that the drinking or the drugs, and even behavior, shopping, whatever it is, gambling, it's a Band-Aid.
And I'm glad you're talking about tapering back. And my next statement isn't designed to be humorous, but addiction is one of the few treatment areas where we can taper back. And I say that because when a couple comes in for infidelity, you can't taper back from having sex with your mistress. Like, hey, honey, I'm going to have sex with my mistress 3 times this week versus the 5 last week. And then we can hopefully get to a point where I'm not having sex with my mistress at all, right? You can't taper back from, hey, I'm only going to tell you 4 lies this week versus 12 lies, right? So, I mean, there are only a few behaviors that you can taper back on, right?
Yeah.
and I think about change when there's marital counseling involved, there are certain things like you can taper back going, okay, we had an argument, but we didn't name call. We might have raised our voices, but no one was called stupid, dumb, idiot, or out of their name, right? So that could be a taper back approach. Talk about what you do in terms of treating couples or clients with addiction, utilizing kind of a tapered back approach, which may go against the grain of the traditional abstinence only approach.
Well, in a sense, there's at least a couple of things to consider. Let's say I'm meeting with a couple, okay? And let's say the person who's not drinking or using drugs, they're fed up and they just want that person to quit.
Mm-hmm. Which is usually the case.
Yeah. Funny, I should mention it, right? So my first step, so to speak, is to help the person realize that cutting back is more realistic and has a better chance of having a consistent outcome than just stopping. But I also acknowledge, and also I want the person to tell me what they've been through and why they want that person to stop immediately, and how the approach I'm suggesting would give them the best chance of having the experience they really want with their spouse.
Gotcha. It's interesting as I listen to you speak on the tapering back and setting realistic expectations, communicating with the spouse, and it's almost like a negotiation, but you're also being very strategic because as the addiction counselor, you're also like the project manager as well, right? Like you're in these multiple roles. I really do believe that the work you're doing, 50 years and counting, in addition to your book, your online program, all the thousands of clients you've helped over this course of your career, it's truly a legacy. And, the honor of having you on the show is the Marriage Underdogs radio show gets to be now part of that legacy as well with this interview. In closing, I want to make sure I'm giving you an opportunity to talk briefly about your book, your courses, and then the listeners get access to those resources and you as well if they're in the Houston area or they're out of New Jersey. You do virtual New Jersey and Houston, or New Jersey and Texas, excuse me.
Yeah, New Jersey and Texas, yes.
Definitely. So the book, talk about the book briefly, the course, and then segue into a plug for those that are in Texas or New Jersey that would love to connect with you for the virtual telehealth therapy.
Okay. Well, first of all, the name of the book is Back to Living, and the subtitle is Action Strategies to Recover from Your Addiction. What makes my book different, it's not the only book probably ever published that has this information, but what I have found is books based on addiction usually only talk about treatment and abstinence.
Mm-hmm.
My book talks about how to be in recovery. Abstinence is part of recovery, but it's not the whole picture of recovery. The e-learning program elaborates in much more detail how to live a life. There are three main categories that are covered: self-discipline, managing your thoughts, and developing micro habits.
Those little habits that make big impacts.
Exactly. Rather than make a big change immediately. That's not realistic.
So you're really talking about a lifestyle then.
Exactly.
Your lifestyle, not necessarily just trying to take a quick fix-it pill. Got you.
Exactly. Now, for anyone that's interested in learning more about that, the website that has the link to my book, which people could purchase through Amazon, and also it has a link to the e-learning program, which they would just purchase directly from the website, is lifemasterywithalan.com.
lifemastorywithalan.com.
Yes. And if anyone wants to speak with me on the phone, my phone number is 281-785-0660. And besides the blogs that I have on my website, the lifemastorywithalan.com, I also have an Instagram account. It's alansimberg.therapy. And I have a lot of information about recovery from addiction on the different posts.
And we'll make sure to put this information in the show notes as well, so our listeners can get easy and quick access to it. Alan, just thankful to have you, as I shared earlier multiple times over, to have someone who's been in the field as long as you have, all the different experiences, the knowledge that you've collected, and to share that with us today has been truly a gift. I'm really thankful to have had you on. Is there any final words you want to give to our listeners before we jump off today?
Yes. One of the things that I want everyone to be aware of and to know, please don't ever give up. Sometimes it takes multiple attempts to have the life that you want to have. But when you make that attempt that gets you the life that you want to have, all the other times that maybe you didn't quite follow through, they don't matter anymore. What matters is you've now taken the step that can give you the life that you deserve.
That was, mic drop. Love it. That was. Hey, I'm not gonna say anything. I'm gonna let that marinate. I love it. Dr. Simberg, it's been a gift to have you. I appreciate it. For those that have been tuning in, my name is Chris A. Matthews, and you've just had the opportunity to listen to another episode of the Marriage Underdogs radio show. We post new episodes every Tuesday at 10 a.m. on Spotify and Apple Podcast. Also, if you're interested on being an expert guest on the show, or a couple that would like to come on the show, please visit the Marriage Underdogs radio show podcast.com and submit an inquiry form. And we look forward to bringing you a new episode next week. Thank you, Dr. Simberg.
My pleasure. Thank you for having me.
Thank you.